participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And I want to welcome everyone here to our little series of podcasts that we're doing here at Gold with some of our speakers. And my guest today is Lisa Lahey. Welcome, Lisa. Lisa, it is wonderful to have you here.
I'm excited. This is my second time to present at Gold. Last year was my first presentation from Gold, so it's good to be back, and I hope that our listeners will learn a lot from this year's symposium.
Absolutely, and we're talking everything tongue-tie, isn't that right? We are talking about the tongue-tie symposium here at Gold Learning that will happen in September, and we had a symposium last year as well. But Lisa, there's so much more to talk about, right?
There is, and this is what I really like to talk about. It's a big part of my practice. I would say, what I'm known for in my area. I live in Indianapolis, Indiana, so in the Midwestern part of the United States. And we do see a high incidence of tongue-tie or a prevalence of tongue-tie. And I think, when working in private practice, people have really looked at basic breastfeeding issues. And so by the time they're finding me, then the assessment for tongue-tie is really needed.
Right. And so important, absolutely. Now, before we get into the topic and your presentation, tell us a little bit about yourself and your professional background and your journey. How did you get to where you are today?
Well, I've been a nurse for 23 years. I worked in labor and delivery and postpartum and the NICU, so really all aspects of maternal child health. I worked in the hospital for 17 years, and then this is my 5th year in private practice. What's new for me this year is I am halfway through my nurse practitioner program, so I will be starting my clinical practicums in January of 2020, and my hope is to open a breastfeeding medicine clinic in my city.
How exciting, Lisa. Well, congratulations, and we wish you all the best for your journey there. It sounds like that is an absolutely wonderful development. You have such a well-rounded background from, your clinical background to now this furthering your study and then opening a new clinic as well. That's wonderful, and we keep us up to date with that. I hope you keep in touch and let us know how everything will be going for you.
Sure. Thank you. I appreciate that.
And so tell us now a little bit, you mentioned you're in private practice. Tell us a little bit about your day-to-day life, what you do there. To walk us a little through your day.
Sure. I would say typically I see between 2 to 6 patients per day, either at my office or making home visits. It's just really at times the patient's preference. And during a visit, the initial consult is typically about 1.5 to 2 hours, where I'm assessing the latch and feeding, doing the oral exam and oral assessment for tongue-tie. And then a good amount of my time is, just helping to give an adequate care plan to correct the issues that are problematic for the feeding. So, if that is a restricted tongue and lip tie, then oftentimes we're talking about the assessment, what my findings are. We're referring to either a dentist who provides the frenectomy or an ENT, and then helping with some oral exercises to kind of help rehabilitate the function, because my strong belief is that the assessment is important, but a big part of our role now as IBCLCs who are working with oral function is to help get the oral skills to be better and stronger. And so frenectomy provides the opportunity for more mobility, but it is the oral exercises and I think the referral to different body workers, and I do some of massage with my patients as well, and definitely the oral exercises to kind of really bring back the best breastfeeding that we can for that dyad.
You made a very important point there that I'm picking up on is, so you mentioned the frenectomy can help, help with the issue, but then afterwards there is exercises and body work needed. And I believe, often parents or families might not be aware of this, right? I mean, I can see many people coming to you going, okay, now I thought everything would be fine after the procedure. Why isn't this going the way we want it to yet?
Yes, exactly. I think social media is great, but we do have a lot of parents who are going to social media and saying, hey, does this look like my baby has a tongue tie and lip tie? And we really do need that full functional assessment and support of the parent both before and after the frenectomy. And so yeah, a lot of parents are looking for the quick fix, but we have to really remember that the tongue can interplay with other muscle groups, and that's why we would recommend body work to release tension that is held elsewhere in the body. And then also, as far as the quick fix, I often remind parents that your baby's sucking pattern and the frenulum that's been restricted has been there since in utero development. So it takes a while for a baby to learn new muscle patterns and to develop a better latch post-frenectomy.
Very good point there. And you provide a myofunctional therapy as well. Can you tell us a little bit exactly what that is, how that looks like?
Sure. Myofunctional therapy is really neuromuscular education, and we have some primary goals when we're working with babies to adults. And the primary thing that we want to work on first is better breathing and posture, because breathing comes first. And so if we apply that to babies, oftentimes we as lactation consultants are working on better positioning of the baby across mom's lap or be that laid back. And a lot of times getting that postural support also helps with the actual latch. So that would be one thing. If we're having some breathing issues, a lot of times that could be because the tongue is restricted and back in the nasopharyngeal space, and the frenectomy may help with that breathing. And then the exercises would be some oral exercises that we are doing with babies ourselves. So babies cannot be directed to say, hey, stick out your tongue. And when we kind of think of traditional myofunctional therapy, it's more showing patients the exercises, they're doing them after they're being taught. And with babies, we're really directing the work ourselves with our hands and guiding parents and teaching parents what they can do. Now, in my work with older children and adults who may have tongue tie or myofunctional issues that might be a tongue thrust or difficulty adjusting to their orthodontic treatment. We're looking for lip closure. We're looking for the tongue to seal in place against the palate. And so we have very specific exercises that we would be working on during that time with them. And usually those sessions are anywhere from once a week for several weeks or months. It just really depends on what the issue is and what our goals are for the patient therapeutically.
Interesting. Well, thank you for sharing that with us. That was certainly interesting and very informative. Now moving on, you were a contributor to a wonderful book titled Tongue-Tied, right? Tell us a little bit about it and what was your role in this book, what was your contribution there?
Sure. Dr. Baxter, who is speaking, I think, for Gold this time, he gathered several different professionals and said, hey, I have an idea for this book, would really like for you to contribute. I had met him at the International Association of Tongue-Tie Professionals, IATP, at a conference, so that's how we kind of first met. And we just really began to talk about creating chapters for the book. So I think all of us gave our input on how we would like the book to be or what chapters, but my personal contribution, it was just writing the chapter from the lactation point of view. So what is the role of the IBCLC and how we are coming to help patients, babies particularly, babies and young children with tongue tie through our assessment, through our follow-up visits with them, and the emotional support. And I think really, tongue tie was put on the map often by lactation consultants, and we are working daily with these patients. So I'm really glad that I was able to contribute what our role is in my chapter for the book. And so our book just was 1 year old in in July, and it's been great to hear people's feedback on the book to say, hey, this was really helpful. I thought it was really comprehensive, that there was various perspectives from professionals, and I often have copies of the book to give to other professionals who are maybe early in their learning stage, and I even share it with parents who are wanting to learn more. And I feel that's the beauty in the book, is that it's easy to read. It's not so technical that a layperson would have difficulty getting through it.
Wonderful. Perfect. Okay, now let's move on to your presentation that we are very excited about, the foundation of TOTS assessment, anatomy, appearance, and function. So tell us a little bit what you will be presenting on and why you picked this topic and what you're hoping our delegates will take away from it.
Well, I'm hoping that in my presentation that the participants will learn more about how to assess the anatomy and what we're looking for specifically when we're doing the oral exam for TOTS. So if I'm placing my hands on the baby and I'm lifting the lip, what am I looking for? What am I feeling? So if I lift the lip and I'm seeing tension, I'm going to see some blanching on the gum ridge. I'm going to be watching how the baby's reacting, and I'm going to take note of where the frenulum attaches anatomically. When I move down to the tongue and go to lift under the tongue, lifting up and back, I'm doing the same thing. I'm taking note of where the frenum is. Is it thick? Is it thin? Is it blanching? Does it seem very mobile? Or is it very tight and restricting lift or movement with the tongue? Because there usually is a frenum for every baby, so we all have frenums, and how do we decide as practitioners which ones are restricted and how we go on to refer for that? And I think the screening tools can be helpful for that, and I find that some practitioners aren't using screening tools, some practitioners are, and if you are early into your introduction of learning how to assess for tongue and lip ties, the screening tools can be helpful because they're a visual reminder of, have you looked for the lift? Have you looked for the cupping? Have you looked at the spread of the tongue? And then we can mark that and score that, and then that can also be used to send on in your consult note to the pediatrician or to share with the parents. And I find it kind of is that written communication needed to back up the assessment. Now, a screening tool is just to screen, so we still know that it's not perfect, that it could miss some tongue ties, and that's where our clinical judgment and experience comes in. So I do think that the tools are important at teaching just the basics of what we should be looking for. And there's 4 great tools out there currently, and I've used all of them, and probably like, just sharing those during my talk coming up.
Wonderful. And you will also use videos in your presentation to show. That's always so helpful, I find.
Yeah, yes, I'm excited to do that. I take a lot of pictures, clinical photos during my consults. I find that that's also very helpful when explaining and showing the parents the restrictions. So I've shared a lot of photos in my presentation that are mine. So hopefully our participants can learn, and maybe they would also consider getting consent and taking photos if that's something that they can do in their particular practice setting.
Wonderful. Well, thank you so much, Lisa Lahey, for talking to me today about your background, anything tongue-tie, and your presentation.
Thank you, Kristen. It was my pleasure to speak with you today, and I look forward to the presentation coming up.
And we will speak with Lisa again in the live day of the presentation on September 16th. And to our listening audience, we have 10 presentations lined up over 2 days live. Fascinating new research, clinical skills, everything related to tongue tie. So don't miss out. Go to our website at goldlearning.com and find out about our tongue tie symposium of 2019. All the presentations are listed there, all the speakers. You will find out exactly which presentation is happening when. So I encourage you to go there and find out more. And we were looking forward to seeing you there. Bye-bye, everyone.